Thanks so much there, Kevin. It is the season for winter and holiday fun, but it's also the time of year for some injuries. Joining us in this sponsored segment from Advanced Physical Therapy in Davison, we welcome back to the show Physical Therapist Assistant Adam Amon, talking about, it's the time of year to decorate, drag out all the ornaments, things like that. First off, though, what are some of the more common injuries that you do see this time of year?
Unfortunately, we see a lot of injuries with slip and falls. It just is what happens. A lot of slipping, hip issues, some back issues. We do see a little bit more in the back pain issues because of the lifting and repetitive snow movement that we know is a big problem right now.
Comes with the territory.
It really does. It really does.
Well, let's talk about, what pitfalls can we avoid dragging out the tree or hanging those lights if you haven't done that already?
So hanging the lights specifically, you want to be careful to make sure if you're hanging lights above your head that you're trying to get up onto a step that's closer. You don't want to be super low and then reaching up. You want to be up closer so you're about eye level. So whatever you're doing in a safe position. As far as dragging trees out, there's really no good way. You're going to clean it up afterwards anyways. Rip that sucker out the door. It'll be fine. You'll just clean up all those needles afterwards.
All right. Well, it hits home talking about the lights because I've been guilty of the tippy toe move, in the past.
Me too.
You have a prop with us today, even though I don't really know if I want to see the shovel yet. But let's talk about shoveling. What do we need to know?
So this is an ergonomic snow shovel. Specifically, it's designed so that you can just push it as opposed to having to scoop. You would just kind of push straight down the line. If you didn't have something like this, and that's okay, and you're going to shovel snow anyways, and you go to scoop, what you actually want to do is isolate this arm straight down and set this arm straight up and then bend and lift, as opposed to trying to use the leverage of the knee. You got a lot of back movement there that you don't need. It's very dangerous to do that.
Sure. Well, bottom line, we've seen these in stores. What's the advantage to getting this type of snow shovel?
So specifically, it's this design where you're not having to get a leading run up to push the snow. You can just stand directly behind it. It's already got a great angle at the bottom there, and you can just walk forward with it on the lighter snow days. The heavier snow days, maybe look at something else.
Yeah. Okay. Have it do most of the work for you.
Yeah.
You talked about this slipping, falling on the ice, very common this time of year. What do you got for us there?
It's tough. There's really not a whole lot of great ways to avoid it. The best thing you can do is create as much surface area between your foot and the ground. Don't walk on your tippy toes. If you have to shuffle a little bit, make small steps. You do not want to put yourself in a dangerous situation where you go to step and slip. That's obviously the dangerous way to go about it.
I've always heard waddling like a penguin helps.
You can do that, yeah. I do that all the time.
And then quickly here, a lot of us traveling to see family, friends, long car rides. Any suggestions there to prevent some back pain?
If you're taking a longer one, even I would suggest over an hour. I would try and stop after about a half hour. Get out of the car, do some standing and stretching, walk around a little bit, find a rest stop. Sitting for a long period of time can create nagging back pain that'll last a longer time, and we just want to avoid that, especially during the holidays. You don't want to be hurting.
Of course. Hey, if you got the snow shovel in the back, maybe do some stretches with that.
That's exactly right.
And then quickly, why should folks consider PT over medication, surgery, things like that?
So it's not that they shouldn't consider those things. It's that pain medication has a tendency to create a bit of an addiction issue with the opioids involved. Surgically, that's a last case scenario for even surgeons most of the time. We want to avoid having to go into those situations. Anesthesia is fairly dangerous, and there's no guarantee that you'll be fine afterwards. PT, we can handle a lot of the treatment conservatively. We can control pain, and we can improve your overall scope of life.
There you go, Adam, always helping us out with some great pointers there. Let's show that information for folks at home. Advanced Physical Therapy Center with those 9 convenient locations for you listed there on your screen. There's a website as well. And thanks for doing the shoveling.
Thanks a lot, man. Yeah,
I'll catch you next time.
Yeah, no problem.